I enjoy the immediate gratification of seeing the patient. And it's like Christmas time when you deliver new teeth for someone, like a partial or denture, and or get them out of pain and they're really happy. And there's a win in that. Um, but at the same time, there is also a huge gratification in what you can learn from the bench that you can take to a patient. And so I've just kind of continued my career in parallel with those things. And yeah, for me, science really was a tool. And I really thought scientists were these very, you know, but now I realize and share with many young people that everybody who asks a question is really a scientist. As
Okay.
deputy director of NIDCR, the impact, being able to make programmatic change beyond a person at a time. This opportunity allows the potential to impact much more broadly and really help to implement something that I hope will make a difference for the world in terms of oral health. It's a trade-off, but I was able to negotiate to maintain a laboratory, which was great. And we'll see how it goes. I mean, I do think it is a fair trade-off in terms of potential impact, because not only can I do the science that I do, but I can help promote other people's science in a much more significant way. I've been involved in training programs and that. So, but now we can help build. So I was at training programs like at my one site in North Carolina, but now I can help build training programs for across the nation. And with Fogarty, hopefully we can help to help stimulate more oral health interest globally. Oral cancers are a major problem.
Okay.
And in fact, virus-associated oral cancers are now the major cancer in the US, right? Okay. HPV is the big one, but also Epstein-Barr virus causes lymphomas, and Kaposi sarcoma causes malignancies, mostly in the context of immune suppression. So even more than smoker drinker cancers, these virus-associated cancers are more than 70% of head and neck cancers in the US. So it's a big problem. I cannot tell you, you name a disease, I can tell you what the link is in the oral cavity. It's huge. Every patient, or most patients at major medical centers who are getting a transplant have to make sure they'll have any active oral disease, because it could compromise the transplant. People who are diabetic, if they have uncontrolled periodontal disease, diabetes is worse. We've been working with some of the folks at Fogarty to really think about how we can maximize the impact of some of these collaborative projects that we have ongoing. And maybe bringing in studies from larger institutes that have the bigger infrastructure in terms of trials, and letting the oral community know, and the trials communities like cancer, NIV, child health, and bringing these triangulating to bring these together so that the impact can be much more significant, so we can understand what's happening in terms of oral health. And once we understand it and do the research, we can work towards intervention and prevention. I think that everything that we learn globally helps us all. And it's true. I mean, if you look at NIAID, why are they doing all these studies in Africa and all these other places, right? The burden of HIV and some of these other illnesses is much bigger there. So you have the resource to, one, help, but two, study so we can understand. And I think this is true for multiple infectious disease. I mean, like Ebola and other infectious diseases. So I really think it's important that as global citizens, we understand what's happening in terms of disease and disease patterns, because I think it helps everyone in the long run. Mm-hmm. And only see it as a win, because people are people. But particularly here in the US, I mean, we're built on our differences, and people, again, come from all over the world. So helping citizens elsewhere and learning from that helps our citizens here as well. My parents were always very encouraging. I got to, when I got to college, the pre-health advisor was like, "Well, maybe you should focus on social science." Okay. I got to dental school. "What are you doing here? You're taking the man's seat, blah, blah, blah." And as I've moved on, it's been, well, when's the doctor coming in? Or yeah, we're at a scientific meeting and, well, who do you work for? Right? Or if someone will ask my lab associate, who happens to be a white man, to tell, and he says, well, she's the PI, Okay. But you have to persist. You have to persist, because I think we're all being called to do something, and we need to do what we can to actually get there and do it, and to try to make it easier for someone else once they come along. So yes, there have been many challenges, but I have been fortunate because this career has allowed me to go around the world, to meet colleagues from all over the place, and to recognize that we have many more similarities than we do differences. And to recognize the onus is on us, if we can, to try to make it better for someone else. And I think that's what Fogarty is all about. Every American with HIV has profited because of those studies, okay. Right? In terms of what the medicines are, how they work, the other, and actually science has benefited in general, because all these opportunistic infections, that's what I work on, all these opportunistic infections that occur at a higher rate in some of those other environments, and we don't see them as much here. We learn from those things, and now we know what to do to treat someone wherever they are in the world. It's been very much touted as, white teeth and all that stuff. White teeth, that's pretty and everything. It's what you show the world, but there's so much more in there. Right. You can take your saliva, you can measure a lot of things in there. Markers for other diseases at distant sites. And who wouldn't rather give spit and get a shot or give blood, right?